Okay, so we're going to be talking about the digestive, the urinary, the endocrine, and reproductive system. So when you think about the digestive system, what is the purpose of it? Well, its job is to break down food so that it can be used by the body. So there's both chemical and physical breakdown of food, and we talked about that some in class earlier. So the digestive system has several different parts. It has the alimentary canal and then the accessory organs. So when we think about this alimentary canal, it goes all the way starting at the mouth. Oops, hold on. Let me get my pointer back up. Okay, so it starts here at the mouth. It's going to come all the way down, follows through the stomach, and then it's going to enter into the small intestine. Small intestine then connects to the large intestine, and then it's going to go around and out. So that's that whole canal. The accessory organs then are the organs such as liver, spleen, pancreas, etc. Sorry, now I can't make it move on. There we go. Okay, so the alimentary canal, this is that long muscular tube, like I told you, begins at the mouth and goes all the way through and then ends at the anus. Accessory organs, salivary glands, tongues, teeth, liver, I should have said that, gallbladder, and pancreas. Now the mouth or buccal cavity or oral cavity, this is where food is going to go into. It's going to then be responsible for both some chemical digestion and mechanical digestion. So chemical digestion is going to, be from the saliva, and then the mechanical digestion, this is the process of the teeth grinding, tearing, and chewing. Other organs or parts of that cavity would be the teeth and the tongue. The tongue is very helpful because it moves that food around up here, and you can feel this with your own tongue. If you press, you have the hard palate, and back in here is the soft palate. We have some salivary glands that are going to release saliva in here, as well as the tonsils. So the pharynx or throat, this is a carrier for both air and food, like we're talking about in CPR and first aid. So it's going to carry that food, that bolus or that chunk of food that you've chewed up. It's going to carry it to the esophagus, and then the esophagus is going to have that peristaltic motion. It's going to move that food through and down into the stomach, where it can be further digested. Now, what keeps that food from going into the trachea or the air tube? That's called the epiglottis, and that closes so that food does not pass through. So the esophagus is a muscular tube. It is going to lie behind the trachea and carries that bolus of food to the stomach. And again, it's that word peristalsis, that's that rhythmic contraction of smooth muscle that moves through. The stomach's going to receive that food. It's got tons of rugae, and so I want you to look the term rugae up and make sure you understand what they are. As a matter of fact, I want you to write on your notes here, rugae, and then make sure you have a definition from the book on that. So I'll be expecting to see that in your notes. From the stomach, it's going to pass through then into the small intestine. Now, every time you empty from one part to another, you're going to have what's called a sphincter. So we've got two different sphincters in the stomach, one coming from the esophagus into the stomach, and then one going from the stomach into the small intestine. Generally speaking, we're going to have food in the stomach about 1 to 4 hours after eating. And of course, that's where we're going to be getting our gastric juices. So when we talk about those gastric juices, I want you to write this down. separately or on the side of your notes here. So gastric juices are produced by glands in the stomach, and these juices have hydrochloric acid, hydrochloric, and the purpose of hydrochloric acid is to kill bacteria. It also facilitates the absorption of iron and activates one of the enzymes called pepsin. So make sure you have that included in your notes. Now the small intestine is that first part of the intestinal tract. There's three parts of it: the duodenum, the jejunum, and the ileum. You will hear duodenum and also duodenum. Either one is fine. So you need to make sure you understand some of the, or write down some of this. So the duodenum or duodenum, I want this written down, is the first 9 to 10 inches of the small intestine. And this is where bile from the gallbladder and liver and pancreatic juice from the pancreas enter in. The jejunum is about 8 feet long, and so it's going to form the middle section of the small intestine, and the ileum is the final 12 feet of the small intestine. So that final 12 feet is the ileum, and this is going to connect with the large intestine at the cecum. There is another sphincter, and it's the ileocecal valve that separates the ileum from the cecum. Make sure you write down the extra information that I've just given you about the small intestine. Now again, in the small intestine, we've got those intestinal juices like we talked about, and we talked about the bile. One thing that I'd like you to know is that in the intestinal tract, there's all those villi, and they're like kind of like fingers or projections in the wall of the small intestine, and this really helps to increase the surface area of the intestinal tract, so there is lots of surface for absorption. So moving from the small intestine, you go into the large intestine, and the large intestine is about 5 feet long. It's also wider, so it's got a bigger diameter, about 2 inches. And so the function of the large intestine, again, you're going to need to include this on your notes. The function of the large intestine is to absorb like water and then any remaining nutrients, but this is where the majority of water is going to be absorbed. It also helps to store that indigestible materials before they're eliminated from the body, and this is important for the synthesis and absorption of some of the B complex vitamins and vitamin K. This is an important concept because if we end up with a patient that's had some of the large intestine removed, we need to be aware of that fact that, number one, they may end up getting dehydrated easier because they're not able, they've lost some of that surface area to absorb that water back, as well as they may end up with some deficiency in some of the vitamins. Now, the cecum, this is the first section of the large intestine, and again, that's where the ileum and the small intestine connect, or the ileum of the small intestine connects with the large intestine. And this is where the appendix is. The colon itself, then, the large intestine broken down into 4 basic parts, and you need to write these down. So the colon, you've got the ascending colon, and that's going to go up on the right side of the body. The transverse colon, which is going to extend across the abdomen, and then the descending colon that's going to go down the left side of the body, and the sigmoid colon, and that's that S-shaped section at the end and joins with the rectum. And then, of course, the rectum, this is the last 6 to 8 inches of the colon, and this is where stool is going to be stored until we expel it. Now the liver is the largest gland in the body, It's one of the accessory organs, and it has many different functions. So it secretes bile, stores sugar and iron, as well as some vitamins, produces heparin, produces clotting proteins, cholesterol, and is very important in detoxifying the blood. So a couple things I want you to know about would be heparin. So what is heparin? This is a substance that prevents the clotting of blood. And so it also is going to produce the clotting proteins. So when you end up with liver disease, you can have some real issues in regards to blood clotting. Now, the gallbladder, this is a little sac, it's a little muscular sac, and this is located by the liver, and it stores and concentrates bile, which it receives from the liver. And then when bile is needed in the digestive tract to help break down fats, the gallbladder is responsible for releasing. The pancreas is a fish-shaped organ located behind the stomach. Produces lots of pancreatic juices that helps digest food, as well as insulin, and then the counter-regulatory of insulin, glucagon. So the pancreas is a very important organ in regards to not only digestion, but is in also the use of food. So the pancreas, the enzymes that it is going to release is going to be amylase, amylopsin, and then trypsin and chymotrypsin, and so as well as lipase or stepsin. So I want you to look up the enzymes from the pancreas and make sure to include some of those in your notes. Now, there's several diseases and abnormal conditions. And what I want you to do is for each of these, I want you to look them up in your book and make sure you put down definitions in your notes. So for appendicitis, cholecystitis, cirrhosis, constipation, diarrhea, diverticulitis, gastroenteritis, hemorrhoids, hepatitis, hernia, pancreatitis, peritonitis, ulcer, and ulcerative colitis. So all of those you're going to look up in your notes. The urinary system, this is our system of excretion for liquid wastes. And so the urinary system, that would be the main function of the urinary system. It is going to be to remove waste and excess water from the body and then get rid of it. It helps also, it's very important in regards to our blood pressure control and some other issues with the heart. So we have, as part of the urinary system, we have 2 kidneys, normally speaking. We have 2 kidneys, 2 ureters, a bladder, and a urethra. And each of these parts, again, this would be normal that you have the 2 of them. However, some people are born with only 1 kidney and 1 ureter, and certainly can live on that, or maybe only have 1 because of disease, or perhaps they donated it to a family member or somebody else. So here we can see the urinary system. These are the kidneys. And then there's a very big blood supply that goes into them because the kidney's job, again, is to filter the blood of those waste products. And so this is important for you to understand, and I'm going to just kind of stop right here. I want you to look at this because, again, this is an important thing for you to understand. So here are the kidneys, and you've got this big blood supply. These are the ureters. And here's the bladder. Now, in the bladder, you can see that these ureters kind of empty in to the sides, or kind of almost the base, really, of the bladder. You know, they're not just hooked into the top of it. They're going kind of around the bottom and more to the back of it, or in the bottom of it, the inferior aspect of it. So then the area between where the ureters come in and then the opening of the bladder to the urethra, this is called the trigone. And this area here is easily cultured for bacterial infection or UTIs. And then you can see, of course, that the urethra going out. Well, if you end up with an infection, a UTI, a urinary tract infection, generally the infection is going to start at the urethral orifice. And then what happens is that this ends up getting colonized. So the bacteria grows and moves up the urethra, and then it gets into the bladder. Well, then in the bladder, once it gets here, I mean, urine is full of all kinds of good stuff that bacteria really like. That bacteria can quickly colonize up and end up in the kidneys. Now, when you end up with an infection in the kidneys have a very, very intricate relationship with the blood because that's what they're filtering. So from the kidneys, it is very easy to end up getting an infection into the blood, and so people become septic. So it's very important to have good hygiene in regards to the external urethral orifice. In other words, this is why little girls wipe front to back. So the hilum, that's a notched area in the kidneys, and they are going to have, this is where the blood vessels and lymph vessels come in, and as well as the ureter, there's nerves, so that's that kind of notched area there. And then the nephron is the functional unit of the kidney. Nephrons are what actually doing the filtering of the blood. So the ureters themselves are about 10 to 12 inches long, and they're going to extend from each kidney going down and dumping urine into the bladder. And again, we see this term peristalsis, this rhythmic motion of involuntary smooth muscle. The bladder, a muscular sac, it's got 3 basic layers. And again, the function of the bladder is to hold urine until it's full enough that it needs to be emptied, and then you get that urge to go to the bathroom, and we have control of those sphincters. We relax the sphincter, and then we can urinate. Now, another term for urination is to void. So that's a term that we're going to use with our peers. I'm not going to go up and ask another nurse or a doctor if the patient peed or urinated. I am generally going to say something like, did the patient void? The urethra, as I showed you earlier, is going to carry urine from the bladder to the outside of the body. And the difference between the urethra in the male and the female is that the urethra, clearly, I mean, only makes sense, is going to be longer in a female than it is, or in a male than it is a female. So for females, it's really only about 1.5 inches long, whereas for men, because of some of the coiling, it's like 8 inches long. So it's a much different thing. This is one of the reasons that girls have a tendency to get bladder infections more frequently. Now I'm going to want you to go back again, just like you did with the other systems. I'm going to want you to look up and define these various different diseases and abnormal conditions. So we have cystitis, glomerulonephritis or nephritis, pyelonephritis, renal calculus or urinary calculus, renal failure, chronic renal failure, uremia, as well as urethritis. So very quickly then, the endocrine gland. This is our system of internal excretions. In other words, these are our hormones. And so hormones get excreted or secreted actually directly into the bloodstream, and they have all kinds of different functions. We have many different endocrine glands, as you can see here. And so all of these substances, these hormones, have various functions in our body and help us to function, help the body to function, as well as it's kind of like chemical messengers in the body. So the pituitary gland, this is the master gland of the body. This kind of controls the other ones and has various different conditions associated with it. So again, for these conditions, I want you to look them up. Acromegaly, giantism, diabetes insipidus, and the thyroid gland, this regulates the body's metabolism, located in the neck. And we need iodine from our food intake to help our thyroid function normally. So some of those associated conditions, again, before you turn in your notes, I want you to look these up. You have goiter, hyperthyroidism, Graves' disease, and hypothyroidism. So the parathyroid glands, they lie next to the thyroid glands, and they're important in the, regulating the amount of calcium in the blood. And so calcium in the blood is important because calcium is very important in muscle function. So, and so thinking about cardiac muscle function as well, that's an important thing to understand. Associated conditions that you need to go back and look up is hyper and hypoparathyroidism. The adrenal glands, these are located right above the kidneys, and the associated conditions with those, Addison's disease and Cushing's syndrome, again, you need to make sure you look those up. And then we talked a little bit about the pancreas already. I talked to you earlier that it's both an exocrine gland, which means it releases digestive juices, and endocrine. So it's responsible for insulin and glucagon production. And then the condition I want you to look up is diabetes mellitus. The next set of glands, or the next kind of grouping of glands, would be the sex glands. So our main sex glands are the ovaries and the testes. So the ovaries are the female sex glands located in the pelvis, and they are responsible for regulating menstruation and our secondary sexual characteristics, whereas the testes in the male, those are the male sex gland. They're located in the scrotal sac, and they produce the hormone that regulates secondary sexual characteristics for men. The thymus is located in the upper part of the chest, and it's really active early in life. It just atrophies and wastes away during puberty. It doesn't have much function after that. The pineal body, this is located in the brain, and we don't necessarily know the exact function of that yet, but we do know that it is one of the endocrine glands. And then placenta, this is a gland that is a temporary gland, and this occurs during pregnancy, so it forms as that egg is fertilized, and the function is to support the birth of the child, as well as regulating those hormones that the mother needs to maintain that birth or maintain that pregnancy. And the placenta is expelled after childbirth. And then very quickly, we're going to talk about the reproductive system. So obviously the reproductive system, the main function is to produce life. And it consists of the sex glands and accessory organs for both male and female. So when we think about the male reproductive system, the testes, again, this is the functioning unit. This is where the sperm are going to be formed. It lies in the scrotum or the scrotal sac. It has many different parts to it, as well as so the epididymis, the vas deferens. This is what happens when we talk about a man goes in and has gets clipped, is one of the things that they talk about, so that he doesn't have any more children. A vasectomy is cutting this tube here. As the sperm are formed, they're going to go up and around here, and then they're actually going to be ejaculated out through the penis, the same place that urine is expelled, which is a little bit different in women. And of course, you have testes usually, normally on both sides. The female reproductive system, of course, you start with the ovaries here. Ovaries, this is where the eggs are. So an egg matures every month, and then is released. And if it is not fertilized, then it's expelled through the body, and then that would be menstruation. So the ovaries, interestingly, women are born with all of the eggs they're ever going to have. However, men continue to produce sperm their entire life. The uterus, this is a hollow tube. This is where the baby is eventually going to implant and then be able to grow. The vaginal canal muscular tube connects the uterus through the cervix to the outside of the body. The vulva, those are just the structures that form the external female genitalia. And then, of course, one of the accessory organs not located close by, but certainly very important in the female reproductive system, would be the breasts, and they are responsible for the nutrients for the baby after the baby's born. Okay, so that kind of is going to wrap up this last set of notes. Again, I know this is really long. You have a lot of extra information that you need to write down in these notes. I'll be looking for that when you turn it in. So make sure that you get all of that information. If you have any questions about anything, please feel free to ask. And if I'm busy over at CPR and you have a question, then just write it down or text me, and I'll try to make sure I get it answered for you. Have a good afternoon.